There are many changes coming to federal health care, and that's going to affect you. So today I have two experts to talk about exactly how it's going to affect your pocketbook and your life. Welcome to the show.
Thank you.
Thank you. Thanks for coming. Maybe you can each tell us a little bit about yourself and how you got into this business, and then we'll go into an overview of the industry and maybe how the Affordable Health Care Act and also Obamacare is going to impact Hawaii.
Okay.
Reg?
Reg Baker. I'm the Executive Vice President for Hawaii Medical Assurance Association, HMAA. I got into healthcare about 15 years ago, and I've been fortunate enough to be able to work on both sides of the desk. I've been on the provider side as well as the insurance side. So I have somewhat of a unique perspective on how all this is going to work or supposed to work.
Great. Okay, and Paul?
And Paul Kaiser. I'm Chief Operating Officer of Hawaii Western Management Group, which is HMAA's third-party administrator. And I've been in the insurance industry for 28 years now, and I've also spent 8 years in that also managing the health plan for a large multinational manufacturing company. So like Reg, although it's a different side of the fence, I've had experience in both the insurance side and the employer side.
Great. Okay, so I just wanted to get some information out. That's why I asked you to come today. For the general public who doesn't really understand what's going to be happening here with the Affordable Care Act and Obamacare, and whether they're the same thing, different, and how they're going to interact with what we have in Hawaii.
Okay, well, the Affordable Care Act and Obamacare are essentially one and the same. It's just referred to differently depending upon who you might be talking to. The impact in Hawaii is going to be unique as it relates to how the Affordable Care Act will impact individuals and employers in other states, primarily because of the prepaid law here in Hawaii. So the two will mesh, and whichever one is most generous to the individuals will prevail in those situations where they don't exactly tie out.
So maybe you can just explain a little bit about Hawaii has a prepaid health care act that was passed in the 70s.
Correct.
And for people that are employers, they understand that they are obligated to cover their employees if they work for, I think it's 20 hours a week for 6 weeks, and they basically be considered full-time employees. So maybe, is there anything else that people should know about the Prepaid Healthcare Act? What did I miss? I know there's a lot to it.
Right. Well, as part of my background, I'm new to Hawaii for about 1.5 years, so most of my experience is on the mainland. So prepaid is unique. There is no other state with an ERISA exemption in the prepaid law. And what that has done in terms of other things that the employers are required to do is pick up 98.5% of the employee's insurance costs as well. But I can tell you that with prepaid, the insurance premiums here in Hawaii are typically cheaper than what I have seen on the mainland.
So now how, Reg, did you want to add?
I was just going to say that part of the confusion, I think, comes from a lot of the noise that we're hearing from the mainland. The mainland is having a lot larger transition. Their challenges are greater than we have here in Hawaii because of that Prepaid Health Act. And so a lot of the noise you're hearing from particularly the national media tends to confuse what's going on here in Hawaii. You know, we are unique, and there are unique situations we have to address, but not everything you hear in the national media applies here in Hawaii.
I think a lot of it, too, was when we first started hearing about the Affordable Health Care Act, some of our congressional delegation was saying, at the time they were saying, well, we're going to have an exemption, and you know, and I think there was a lot of confusion even among our political leaders about what was happening and what was in the bill. For goodness sakes, it was a pretty big bill, right?
Yes, it was.
So when is this all going to become effective in terms of the Affordable Health Care Act? When are we really going to see the impact hitting us here?
Well, and actually the act became effective 3 years ago, March of 2010, March 23rd to be exact. And it has a phase-in over a period of 8 years in terms of different components of the Affordable Care Act coming into play. 2010, there were a number of enhancements. The age 26 dependents was probably the most popular, along with the elimination of lifetime limits. And then every year there's been additional parameters of the law that have been put into place. 2014 is the next big year in terms of a lot of changes.
So the 26 rule was that if you have children that are 26, you can cover them up till then under your plan? Is
Correct.
that
Dependents up to the age of 26, whether or not they're working or not.
And then, Reg, did you want to add anything about what's going on right now? Otherwise, we can go into 2014, what people can expect for 2014.
Well, I think one of the points that is also causing some confusion is that October 1st, I believe, is when the Hawaii Connector is supposed to go live. Now, that's a little misleading. All it is, it's an open enrollment period. So October 1st is just a point where people can go on the connector and start looking to see what's available. And it may not have all the plans that are going to eventually be on the connector. They're going to be adding these as they are able to. And there's a lot of work that's got to be done between now and then. And so October 1st is a date that's just for open enrollment. It doesn't actually become effective until January 1st. And there's a lot of confusion about that.
Now, can I just ask you, if say I'm working for somebody and I have insurance already, do I have to change that under this new plan? I don't have to leave my, for example, I have, your insurance or whatever, somebody else's insurance.
Right.
And I mean, is that kind of all being settled now, or is that still up in the air? Do I have to give up my plan and get a different plan off this Health Connector, or how does it work?
No, but all the insurance carriers are submitting plans to the Department of Insurance and Department of Labor to qualify under the parameters of the prepaid law and the Affordable Care Act. And depending on whether or not you get your coverage as an individual or as an employee, there are some different aspects that come into play.
So if I'm say if I don't have insurance now and I don't want it, do I have to get it?
Well, you don't necessarily have to get it, but if you don't get it, there will be a penalty. And the Supreme Court has now defined that as a tax. In the first year in 2014, that tax is $95 per individual if you don't have insurance, or 1% of your annual income, whichever is greater.
So if I get this tax, this fine, does that mean I automatically get into some kind of coverage, or it just means they're mad at me and they're going to fine me?
That just means they're going to collect a little bit more tax from you. Yes.
Okay, got it. So basically, you are required to have insurance unless you want to pay additional taxes, and if you don't have insurance, you're going to have to go on this Health Connector.
Correct.
So when does that work start? When do we actually have to start doing that?
Well, as Reg mentioned, October 1st is the beginning of the open enrollment period for coverage beginning January 1st, 14. And individuals, depending upon their household income levels, may be eligible for subsidies, but that's only individuals. And the subsidies phase out as you approach 400% of the federal poverty level.
So here we already have Quest, I think it's called. That's the government health care for certain incomes.
Correct.
Is that going to be impacted, or do you know?
Those individuals receiving coverage through Quest or Medicaid would continue to do that. So those individuals, if they qualify for that, would not necessarily be forced into the exchange. They would continue to have coverage through Medicaid.
So the main people that are going to be impacted are, besides the businesses and the insurance companies, are the people that just don't have coverage. Is that right? Or do you think it's going to be a lot more than that?
Well, the exchanges could potentially have an impact on every individual and small employers, either at 50 employee lives or at 100. That's still up for decision making at the state level right now.
Oh, wow. They're still trying to figure it all out, huh?
Yes, they are.
Wow, that's kind of a last minute. Reg, did you want to add something?
I was just going to say that there are still a number of issues that have to be addressed.
Right, I would imagine, especially merging the two prepaid health care plans plus the Affordable Care Act.
Well, the Affordable Care Act is the largest legislation that was passed since ERISA. And ERISA has been amended 170 times. And we're just now getting started with the Affordable Care Act. So there's no question that it's going to be changing over time. Once they figure out exactly how this is going to work, they write the regulations and the rules, it will more than likely be tweaked as the years go by.
So when people go on this Health Connector and they look at the different plans, are you going to have HMAA and Kaiser and UHPA? I mean, are those going to be on there and you're going to offer, everybody's going to offer different plans to individuals to buy, or how does that work? I mean, what will they see when they go on the Health Connector?
Well, each insurance carrier makes a decision as to whether or not they want to offer their plans through the connector,
Okay.
the state health exchange.
So you're not forced to do it?
Not forced to do it, no.
Okay.
So that's up to each individual insurance carrier to make that decision. And then they will put out a laundry list of options that either individuals can select from or small employers based on some parameters that are set within the rules.
Okay.
I was just going to say, I think it might be useful for people to know that there's actually going to be two exchanges. There's going to be the individual exchange that people can go to, but then there's also going to be that small business exchange called SHOP, which is the Small Business Health Options Program. And that's going to be a separate exchange. And so you can choose. Some companies may decide to go with one and not the other, or maybe both. So there's going to be two options that people can go to for the exchange.
So small businesses could still come to you individually and other insurance companies and say, what are you offering to my company? But then they could also go through SHOP. Is that how it works?
Correct, yeah.
Okay.
We, as an insurance carrier, can offer, we have to offer the same product and same pricing, but we can offer that outside the exchange or through the exchange.
Because right now the way it works with most plans is that you can buy the premium plan and then kind of a middle plan and a lower plan in terms of like the basics. You just have the very basics covered, maybe not medical, vision, and dental, but you have just basic health care. And then you have at the very top, you have everything covered, right? Or at least mostly covered.
Mostly covered, right.
Yeah.
And with the exchange, individuals will have that broad range of benefit options. Employers, because of prepaid, their benefit options are limited because of the need to provide a benefit plan that meets prevalent plan requirements through prepaid. And so that is primarily gold or platinum level plans under the metallic levels under the Affordable Care Act.
To give you an indication of how well our prepaid health plans work here in Hawaii, there's 4 metallic levels. There's the platinum, the gold, the silver, and the bronze. And when they actuarially determined where our 7A and 7B plans are, that's part of the prepaid health, it was classified as platinum and gold, which is the highest you can be. The Affordable Care Act requires just a minimum of gold and silver. So we're already exceeding the national requirements out here in Hawaii.
So how difficult is this going to be on, for example, insurance companies and businesses that are involved in this whole situation?
I would say one of the major difficulties right now is just understanding the rules of the game, because the game rules are still being written.
Right.
So it's dynamic, it's a moving equation at this point in time, and with the timeline being so short and needing some time to properly prepare and get internal systems up and running and ready to go, that's probably our biggest challenge at this point.
How much of a financial impact do you think it's had on businesses involved in this whole thing in terms of insurance companies? And I'm sure there's other kinds of companies involved, but preparing for this, do you think you've had to spend a lot more money, hire a lot more personnel? How has it impacted the insurance industry?
Well, I would say without question, in terms of staying on top and interpreting the Affordable Care Act and staying on top of all of the clarifying guidance that has come out since, we've absolutely have spent a lot of man hours, people hours, getting up to speed. And then there are some additional requirements, reporting requirements, taxes that, again, we have to be able to measure in order to know what to pay under these new taxes under the Affordable Care Act. That, again, is requiring a lot of resources.
Now, what about doctors? Have you had feedback from doctors in terms of, are they understanding what's going to happen? Are they very concerned? Are they not worried about it because it's a prepaid health care? Or Act already is in place? Or do you kind of see a wide, diverse response?
I think it's across the board. There's responses, opinions in varying degrees, depending upon what their individual situation may be.
And in some cases, it's hard for them to really see exactly what the impact is going to be because they haven't written all the rules yet. There's a lot of rumors going around about how things are going to finally play out, but nobody knows for sure.
Mm-hmm. Now, in the Affordable Health Care Act, what if I'm healthy, or what if I'm not healthy, or what if I have a healthy lifestyle, or choose what to take approach of a wellness approach. Is there anything to work with that kind of person, or a person that's tries to be more healthy, or tries, I guess I'm not sure exactly what you call it, wellness approach?
Yeah, there's a couple of things in the Affordable Care Act. Right now, employers are able to provide incentives for people to achieve healthy results. It may be get a cholesterol reading of X, or keep my blood pressure below Y. And right now you can provide an incentive in the premiums up to 20%. The Affordable Care Act raises that to 30% effective January 1st, 2014. In addition, it also provides for a 50% surcharge for people that use tobacco products, which is something new
That's going to be interesting.
That
wow.
should be very interesting, yes.
So any kind of tobacco products?
Yes.
They're going to come for my beer next, I know it. And then my caffeine.
Well, I hope not. I hope not.
That will get Americans in an uproar if they go after their beer.
One of the more positive aspects of the Affordable Care Act is the shift, or the emphasis they're putting on preventative care versus just addressing the symptoms. And in holding or having the patients more engaged and being more accountable for their own care and being preventative in how they live their life is I think, a very positive thing.
Good. So how, I mean, can you give any examples, or is it still too early to kind of give an example of what a healthy person taking charge of their health care would be like versus not?
Well, I mean, it's really an individual decision. Behavior modification is hugely difficult, and that is an absolute challenge. So it really depends upon the individual to become engaged and say, this is what I want to do.
Yeah.
And they have to understand the benefits for them to get that done.
So it's not going to be just that they're going to be healthier or feel better. It's going to be maybe affecting their bottom line.
Correct. And, well, both. As we just talked about, the 50% penalty for using tobacco products. But I think at the end of the day, it's you know, what will make them feel better about themselves, and again, the bottom line impact of that as well.
The tobacco issue, that's really interesting, because it could actually expand into all kinds of things. You could say, you know, you're a skier, so you have more risk, or you go shooting, you have more risk, or you drink alcohol, or you drink caffeine, or you drink sugary beverages, which has been a big topic this year.
Right.
Do you think it's going to go that far? Is it going to get that specific?
It's a slope that can get a little bit slippery. And I would not be surprised to see more things get tagged on. But it's a crystal ball at this point in time.
Yeah.
And although this isn't health insurance, there's been risk factors like that already incorporated into life insurance.
That's true.
If you have risky hobbies, you're going to pay more for your life insurance. So the precedent has been set. It already is out there. It's just a matter of when it'll be incorporated into the healthcare side.
Well, in 2020, we'll have little health cards that monitor what we buy at the grocery store, and it'll all go back into the health connector, and then they'll decide how much we have to pay.
Well, you may not be stretching the truth that much.
I know.
Did I hear Big Brother there?
I know, I know. Exactly. Well, what other, you know, do you see, in terms of the legislature this year, there's a lot going on, and there's always these discussions about they're going to increase the benefits for different groups. For example, children with autism, or I can't remember. There's been so many health issues, health problems added into what is covered by the insurance. And then how does that impact all of us? Because if you keep throwing in different, like I remember there was one about, was it in vitro fertilization, or
Right.
so I think that was what it was last year. So the legislators keep forcing this in, forcing these issues in, forcing these medical issues in. And then how does that impact the big pool of what you have to cover, because you also have to watch your bottom line?
Well, I mean, there aren't very many benefits that come at no cost. There are some preventative benefits that we expect that will generate savings long term. But any time we have a new mandate, generally that's going to add costs to the program. And with the Affordable Care Act, it does list out 10 essential benefits. Most of those have already been covered by most plans. And really the new ones are habilitative services and devices, and pediatric vision care and dental care. But other than that, everything else has kind of already been taken care of.
The other driver that may impact cost is they removed the caps on the coverage. So, and there's no pre-existing condition. There's no denial. Once you apply for the insurance, you get it.
I was just going to ask you about that. So there's no conditions that you could already have that would prevent you from getting health care?
No.
In what's coming up?
Yeah, there's a guarantee issue, and the only things that the rates can vary upon is age, whether or not you have single coverage or family coverage, the location. In Hawaii is just going to have one rating area, and the benefit plan. So that's about it.
So how does that work? So somebody has a really serious disease and they don't have health insurance and they apply, and then you have to, if they pick you, you have to cover them?
Correct.
Okay, and then can't that bankrupt you eventually if everybody does that? How does that work? I mean, how does that all balance out?
Well,
I'm not a math genius.
That's a potential, but there's
Right.
a lot of components within the Affordable Care Act that tried to offset some of those adverse selection possibilities that may occur the first few years. Again, some of those need to be tweaked and better defined to exactly know how it's going to impact the carriers. But there are some things incorporated into the new law to try to manage that aspect.
Now, I don't know if you know about this, but how does our American plan that we're going to implement vary compared to, say, Canada or some of the other countries that have universal coverage? Is it different? Are we similar? Do you know? Have you been familiar with that?
Well, actually, I have because in one of my prior lives, I did have responsibility for the Canadian benefit plan as well. And there is universal coverage, but there's a lot of supplemental coverages that cover all that. Probably the number one variance I saw between what we had offered up in Canada and the U.S. were the availability of medical providers. Wait times were much longer up in Canada because of just lack of access to as much readily available care as we do have here in the U.S.
I know people were coming from Canada and from other countries to get care here. Are we setting ourselves up for the same thing where we're going to have doctor shortages? And we already do have doctor shortages in Hawaii, I know that, but other places where they might not have that. How is this going to all impact everything?
Well, that is actually starting to get quite a bit of press as it relates to retirement of medical professionals and the new people coming into having health insurance that didn't have it previously, and whether or not we will have a shortage of services.
Yeah, there's some of the reports that I've been getting is that a number of physicians that they get closer to retirement are going to be taking that option a lot sooner, because if they're marginally profitable now, some of the changes that are coming down, the best that they can tell, is going to have a negative impact on their earnings. And if they're not going to be able to add to their retirement, then they're going to go ahead and retire now and keep what they got.
Now, how does this work? This is a little far-fetched question. I'm not sure if you can answer it, and if you can't, that's fine. But we have this free association compact with Micronesia, and we have the people from Micronesia coming here to get health care, and we are obligated as the federal government and the state government cover those costs. And so from what I understand, that if they go to, say, the emergency room at Queens, the taxpayers would cover that because we're obligated to cover their medical expenses. Now, how does that work? Do you know yet how that's all going to play out with the new Affordable Health Care Act, and are they covered with that? Do they have to have coverage? I mean, I know that's like a little bit maybe far into the future, but I was wondering if anybody brought that up.
No, and I don't know any specifics around
Governor
that.
Abercrombie what his plan is.
Right.
I have not heard anything about Micronesia, but I do know that some of the scuttlebutt that's going around is that the hospitals are going to have insurance applications in their emergency rooms. And when you go to the emergency room for care, if you're not covered, you're going to fill out the form and you're going to get the insurance.
I've actually been in an emergency room where that happened now, recently, with the state coverage, helping somebody get Quest.
Right.
That was a legal immigrant who didn't have coverage and needed coverage. So that has happened, and I'm sure that it'll expand now to, I guess, signing up who needs to be signed up. We already see long lines in the emergency rooms. I mean, how is this, and specialists, we can't get specialist appointments. So do you think it's going to get even more difficult?
I think access to care will become more difficult, I do. And it's going to be, I think, a lot of discussion and evaluation of maybe nurse practitioners, expanding their role in the total medical environment. And I know that there's a lot of debate. That's certainly not my area of expertise. I'll leave that up to the medical professionals to decide how best to
And the
arrange
legislators,
that.
because they always get their fingers in it.
Well, I prefer to
I've
leave
been
it to the
watching-
medical professionals.
Right.
And
I've
then
been
they
watching
can
them
make
do
that
that.
decision, but.
There's always at the legislatures, there's always the doctors and the nurses battle, and the ophthalmologists and the optometrists battle, and who has power for what, and prescriptions versus, writing prescriptions, and psychiatrists versus psychologists and all that, so.
The key part is not to sacrifice quality, because if we do sacrifice quality, it will cost more down the road. And that's probably my #1 concern, is to make sure that somebody's got their eye on the quality side, and that we don't sacrifice that to save a penny today.
Right, because our health and our quality of life is definitely on the line, right?
Correct.
Is there a place that people can get information? Where do you get your information? Where can people go to get good information on what's happening, do you think?
Well, there's quite a few websites. Google will do a lot. Healthcare.gov is fairly user-friendly and is focused on the Affordable Care Act. So that would probably be my first recommendation for somebody to go out and look at.
And my only comment to that is that if you do go on Google and you start poking around and seeing what's out there, make sure that you keep in mind that Hawaii is a little unique, and what you might be seeing are issues related specifically to the mainland. They may not apply out here.
Sounds like we need a new health reporter or some kind of news organization that focuses on healthcare a little more than maybe is being done so now.
Yeah. Well, and a good example of that is all the press on play or pay.
Yes.
That doesn't apply here in Hawaii because of prepaid.
Oh, good. Okay. Well, thank you so much for joining us today. The show goes by very fast, and I really appreciate you coming on so that the public can know a little bit more about what's going to be coming very soon. So we'll look forward to the changes coming in up in October 1st and October of this year, right? And then also in 2014.
Correct.
All right. We'll have to have you on the show again.
All right.
Look
thank
forward
you.
to it.
All right. Well, thank you. This has been News Behind the News. Aloha.